Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. I'm Brittany Schaefer. Today we're talking about a device used in the treatment of heart failure.
Heart failure is a condition where the heart is unable to perform its normal work for whatever reason. It doesn't either pump enough blood forward, blood gets hung up in the lungs. Patients will often have symptoms such as shortness of breath or decreased endurance, not able to get upstairs with the same ease as they used to before.
What does VAD stand for?
A VAD is a ventricular assist device, and what that actually means is it's a pump. It's a pump that we use to supplement or at times to replace the pumping function of a patient's heart.
How does a VAD work?
So there are different kinds of ventricular assist devices, but the general principle is that blood is routed away from the heart into the device, and the device will then propel it back to the body. So for example, a left ventricular assist device is a pump that supplements or replaces the function of the left ventricle, which is the left-sided pumping chamber of the heart. This is a model of a left ventricular assist device. You can see that these are the internal components that would be placed inside the body. If we were to break this open, you would see that there's a impeller inside of this titanium device, and that is what circulates and pushes blood through it. At the time of surgery, which is an open heart surgery, a chest incision would be made, which would either be through the bone in the front or on the side, and through that we would connect the pump to the heart. We specifically connect it to the left ventricle. So it's inserted into a opening in the left ventricle. Blood will enter the pump, and then it will be propelled through a graft, which I'm holding over here. This portion of the device is connected to the large blood vessel that comes off of the heart called the aorta. So the sequence is blood going into the pump and then getting propelled through this graft into the aorta.
What are the benefits of a VAD?
The benefits of VAD are when you match it up with the right patient. So a patient who, for instance, has a weak left ventricle and is suffering from symptoms of heart failure where they can no longer do the things that they like to do because they are so tired, short of breath. A left ventricular assist device in that situation can help people return to a quality of life that is reasonable, acceptable, that they can go back to doing the things that they enjoy doing. What that left ventricular assist device will do is it will take over for the weakened heart and pump blood forward.
Does a VAD re-strengthen the heart?
In some situations, the heart can become stronger again after a left ventricular assist device is implanted. Those are few and far between. So if you look at 100 people, it might be 2 out of 100 where that happens.
Mm-hmm. Who are candidates for a VAD?
Some of the things that we look for would be that the patient's heart failure is advanced enough for it to make sense that they undergo this procedure, that their quality of life has become poor, and this device may help them return to a good quality of life. Because the device requires some maintenance by the patient. Specifically, there are some external components such as batteries that need to be attended to. It's important that the patient have some resources in their home. They'll need access to electricity and having some support, whether it be friends, family, that can help them to get to their appointments and just to overall support them in this process is helpful.
Is the VAD intrusive?
There are internal and external components of the left ventricular assist device. The internal components largely sit within the chest, and in order to implant them, it requires an open heart surgery to do that. one doesn't feel the internal components. They're relatively small. But because the patients will need to wear batteries or be connected to a source of power outside of the body, there is a small cable that exits the abdominal wall, which will bridge those internal components of the device that are implanted to external components.
How much has technology improved devices like VAD?
There's been tremendous progress in the development of these artificial heart devices and mechanical support devices. Much of that progress has focused on miniaturization, so the devices have become smaller. That includes the internal components as well as the external components, and they've become safer. So as that has happened, the patient population that can potentially be served by these devices has also expanded.